Across the diverse landscapes of Africa, from bustling cities to remote villages, cholera remains a persistent and serious public health threat. It's a challenge that demands our attention, our understanding, and our collective action. Cholera is a formidable foe, one that can devastate communities if left unchecked, leaving families grieving and livelihoods shattered. The rapid spread and severity of its symptoms make it a particularly frightening disease. This disease moves silently, often unseen until its effects are widespread, casting a shadow of fear and uncertainty over daily life. It can disrupt the very fabric of society, but with the right knowledge, with a clear understanding of how cholera spreads and how to prevent it, we can stop it in its tracks. Education is our most powerful weapon against this disease. Understanding cholera, knowing its causes, its symptoms, and its prevention is the first and most crucial step to protecting our families, our neighbors, and our communities. It empowers us to take control. Fear won't help us. Facts will. Accurate information disseminated widely is what will truly make a difference in the fight against cholera. Let's replace fear with knowledge and action. When outbreaks strike, it's not just a job for doctors and nurses in clinics and hospitals. While their expertise is vital, they can't do it alone. Everyone, from the youngest child to the oldest elder, must play a part in preventing the spread of cholera. Collective action is the key to success. From teaching children the simple yet life-saving act of washing their hands with soap and clean water, to sharing vital health advice with neighbors and family members, every single action, no matter how small it may seem, counts towards protecting our community. In this guide, we'll break down exactly what cholera is, explaining its origins and characteristics, how it spreads from person to person, and most importantly, we'll outline what you can do, starting right now, to protect yourself, your family, and your community, and stay safe from this dangerous disease. These are simple habits, easy to learn and incorporate into your daily routine, yet incredibly powerful in their ability to prevent the spread of cholera. Think of this as your comprehensive guide to building a cholera-proof life, empowering you with the knowledge and tools you need to safeguard your health and well-being. The power to stop this disease, to protect yourself and your loved ones, is right here in your hands. In ensuring the water you drink is clean and safe, free from contamination, the food you eat is prepared and handled safely, minimizing the risk of exposure, and the personal and community hygiene you practice diligently every day. Let's get started. Together, united in our efforts, we can fight cholera and protect our communities from its devastating impact. Together, we can build a healthier future for ourselves, our children, and generations to come, free from the threat of cholera. The time for action is now. Let's work together to create a cholera-free Africa. Cholera is not some ancient curse or a scary myth whispered in the dark. It's not a punishment from the gods, nor is it some inexplicable phenomenon. It's a very real and serious infection, specifically targeting the small intestine, the workhorse of our digestive system. This is where the body absorbs vital nutrients. And the culprit? A bacterium called Vibrio cholera. This tiny organism is the root cause of all the devastating effects we associate with cholera. These bacteria are invisible to the naked eye, lurking unseen in contaminated environments. You can't smell them, you can't taste them, you can't see them, but they can be incredibly deadly if they manage to get into your body, bypassing your natural defenses. The primary way they infiltrate our systems is through contaminated water or food. This could be water from a polluted source or food that hasn't been properly prepared or stored. Once inside the small intestine, these bacteria begin to multiply rapidly. And as they multiply, they release potent toxins. These toxins wreak havoc, triggering severe watery diarrhea and a rapid, almost catastrophic loss of fluids and essential electrolytes. Cholera isn't a slow burn. It can strike suddenly and progress with alarming speed, overwhelming the body's natural defenses. The progression can be so rapid, in fact, that the most severe symptoms can manifest sometimes within mere hours of infection. The most severe cases of cholera can quickly become life-threatening, demanding immediate and intensive medical intervention to prevent potentially fatal outcomes. But here's the good news, the silver lining in this otherwise grim picture. Vibrio cholerae, despite its potency, is surprisingly weak and vulnerable against some very basic defenses. Simple measures like boiling water to purify it, cooking food thoroughly to kill any bacteria, and diligently washing hands with soap and water can effectively destroy it, rendering it harmless. Simple hygiene practices and access to safe, clean water are, in fact, our best and most effective weapons in the fight against cholera. Understanding how cholera works, knowing its vulnerabilities, gives us the power to protect ourselves and our communities, and ultimately, defeat it. Knowledge is not just power, it's our first and most crucial line of defense. So let's use it wisely and effectively to combat this disease. Cholera spreads through the fecal-oral route. It's a harsh reality, but understanding how this disease travels is the first step in preventing it. The journey of cholera is a chain, and each link represents a point where we can intervene. Bacteria from an infected person's stool must enter another person's mouth. This might sound direct, but the pathways are often hidden and indirect. It's not always obvious how contamination occurs, which makes vigilance so important. This usually happens when water sources are contaminated by human waste. Imagine a well, seemingly clean but unknowingly tainted by nearby sewage. This is a common scenario in areas with inadequate sanitation. Poor sanitation lets cholera bacteria get into and thrive in environments where they shouldn't be. Open sewers, overflowing latrines, and a lack of proper waste disposal create breeding grounds for the bacteria. Rivers, wells, or lakes used for drinking and cooking. These water sources, vital for life, become conduits for disease when contaminated. The very water people depend on becomes a threat. Drinking untreated water directly from these sources is a major risk factor. Without proper purification, the bacteria can easily enter the body and cause infection, or eating food washed with it continues the cycle. Even if water is used only for washing, it can still transfer the bacteria to food that is then consumed. Food can also spread cholera, acting as a vehicle for the bacteria to reach new hosts. Contamination can occur at any point in the food preparation process, especially raw seafood. Shellfish, in particular, can concentrate cholera bacteria from contaminated waters, making them a high-risk food if eaten raw or undercooked, or food handled by someone who hasn't washed their hands. This is a critical point of transmission. Hands can easily pick up bacteria and transfer them to food, especially if proper hygiene isn't practiced. Fruits and vegetables washed in unsafe water are risky too. Even if the produce looks clean, it can still harbor cholera bacteria if the water used for washing is contaminated. But cholera doesn't spread through casual contact or the air. It's important to understand this to avoid unnecessary fear and stigma. Cholera transmission requires the ingestion of the bacteria. The bacteria must be swallowed. This highlights the importance of focusing on preventing ingestion through contaminated water and food. This means we can break the chain with targeted actions. By understanding the transmission pathways, we can implement effective interventions to stop the spread of cholera. Safe water. Ensuring access to clean and safe drinking water is paramount. This can be achieved through water treatment, boiling, or using water filters. Cooked food, thoroughly cooking food, especially seafood, kills cholera bacteria. Make sure food is steaming hot before consumption. And clean hands. Frequent hand washing with soap and water is one of the most effective ways to prevent cholera transmission. Every step you take to keep these three things in mind contributes to a safer and healthier environment for everyone. Water, food, and hands clean significantly reduces the risk of cholera infection and protects those around you. Help stop cholera in its tracks. These simple measures can have a profound impact on public health, preventing outbreaks and saving lives. Protect yourself and your community by adopting these practices and encouraging others to do the same. Break the chain. By focusing on these key areas, we can interrupt the transmission cycle and prevent further spread of the disease. Simple actions save lives. Don't underestimate the power of these basic hygiene practices. Let's make them a habit. Integrating these practices into our daily routines is essential for long-term prevention. Together, we can stop cholera from spreading. By working together and promoting these preventative measures, we can create a healthier future for all. Recognizing cholera's symptoms early can save lives. The main warning sign is sudden, severe, watery diarrhea, often described as rice water stool. This isn't normal diarrhea. It can cause life-threatening dehydration in hours. Vomiting often follows, making fluid loss even worse. Watch for signs of dehydration, extreme thirst, dry mouth, sunken eyes, and skin that doesn't spring back when pinched. Muscle cramps, weakness, and rapid heartbeat are danger signs. In severe cases, shock and even death can occur quickly without treatment. If you see these symptoms, act fast. Start rehydration immediately with oral rehydration solution, ORS, and seek medical help. Don't wait. Early action is critical. Every minute counts with cholera. Know the signs, respond quickly, and you can save a life. Stay alert, stay prepared. Quick action is your best defense. Cholera strikes hardest where people lack safe water and sanitation. Drinking from unprotected sources or practicing open defecation creates a direct path for bacteria to spread. Floods and overcrowding make things worse, especially in slums or refugee camps. When many people share limited toilets and water points, outbreaks can explode. Lack of health education and misinformation also fuel the problem. Clear, simple health messages empower people to protect themselves. By improving water, sanitation, and knowledge, we can break cholera's grip. Change starts with understanding and with you. Safe water is your strongest shield against cholera. Never trust water just because it looks clear. Always treat it before drinking or cooking. Boil water for at least 1 minute to kill cholera bacteria. If boiling isn't possible, use plain unscented bleach, 2 drops per liter. Wait 30 minutes and make sure it smells slightly of chlorine. Store treated water in a clean, covered container. Never dip dirty cups or hands inside. Teach everyone in your home to use only this safe water for drinking and cooking. Protect your water from recontamination. These simple steps create a powerful barrier against cholera. Make safe water a daily habit. Your family's health depends on it. Every drop matters. Safe water saves lives. Hand washing with soap and safe water is a simple act that stops cholera. Wash hands after using the toilet, before eating, and before preparing food. Use clean toilets or latrines. Never practice open defecation. Dispose of feces safely, especially if someone is sick. Clean and disinfect surfaces, bedding, and clothing that may be contaminated. Use gloves and a bleach solution for extra protection. Good hygiene and sanitation protect your whole family. Make these habits part of your daily routine. Small actions make a big difference. Safe food handling is another key defense against cholera. Cook all food thoroughly, especially seafood, meat, and poultry. Avoid raw or undercooked foods during outbreaks. Wash fruits and vegetables with safe water or peel them yourself. Keep raw and cooked food separate to prevent cross-contamination. Store cooked food covered and eat it soon after preparation. Be cautious with street food, only eat what's freshly cooked and served hot. Every meal is a chance to protect your family. Follow these food safety rules and keep cholera out of your kitchen. Safe food, safe family. Cholera is a community challenge. No one is safe until everyone is safe. Share what you've learned with neighbors, friends, and family. Talk about boiling water, hand washing, and using latrines at markets, schools, and gatherings. Lead by example. Show others how to stay safe. Support community health workers and follow their advice. Join cleanup campaigns and help improve sanitation in your area. Every safe habit you practice inspires others to do the same. Together, our actions multiply and protect everyone. Don't underestimate your power to make a difference. Every hand washed, every drop of safe water, every shared tip is a victory. Let's turn knowledge into action and build a cholera-free future. The power is in our hands. Let's use it starting today. Together, we can end cholera.